In this video, let's talk about a certain pathology in the spine that can be a little bit confusing, and that is a synovial cyst. At each spinal segment, we know that we have a disc, but there are also two facet joints in the back part of the spine. Facet joints are like any other joint in the body. They are lubricated by a material that allows them to have friction-free motion. The synovium within a facet joint can extrude or come out of the joint and go into the spinal canal. It can go backwards into the muscle and can be a source of pain and certain kinds of symptoms. When a synovial cyst forms that goes into the spinal canal, they can be very painful. And I was talking to a lady the other night who is just in agony because she has a large synovial cyst compressing her left S1 nerve and is beside herself in pain. So synovial cysts are a cause of pain down the leg or pain down the arm that's a little bit different than a disc herniation. But the treatment can be very similar. The goals of treatment would be to go in, remove the cyst, sometimes do a fusion depending on the severity of the arthritis of the facet joint. And sometimes because the facet joint's bad, the patient has developed a slip or spondylolisthesis at that level. So there's a little bit of a clinical judgment to be made on whether or not to just remove the cyst or to do a fusion. Sometimes the cyst can be aspirated with a needle by the pain doctors. In my experience, that can provide some benefit, but the cyst usually recurs, or the contents of the cyst can't easily be aspirated because it's more of a gel or thickened material that's hard to just take out with a needle. One thing to be aware of with synovial cysts is they can get stuck to the nerve. So we have a little bit harder time peeling them away from the nerve than, say, a disc herniation usually is, where it's not stuck or not as adherent to the nerve. So synovial cyst comes from the facet joint and is a manifestation of arthritis to the facet joint and can cause severe radiating leg pain and arm pain, and surgical intervention is very helpful in alleviating the symptoms.